After 11 years of being polio-free, Sudan declared an importation-associated polio outbreak. Sudan's last reported polio case was in March 2009, and the country was announced polio-free in 2015 by the WHO. Sudan remains at high risk of importation of wild polio due to factors including frequent movement between neighbouring countries and within the country. Polio, caused by the polio virus, is a highly infectious disease. It invades the nervous system and can cause total paralysis in a matter of hours. Polio is spread via the fecal-oral route and through contaminated water or food, for example. Other polio symptoms can also include stomach pain, fever, sore throat, headache, and nausea. The re-emergence of polio in Sudan is an urgent public health issue. The only way to end polio is to vaccinate every child in every household. UNICEF Sudan, WHO, the government and partners plan to vaccinate 8.6 million children twice before the end of 2020. The objective of the countrywide response to the outbreak is to ensure every child under 5 years is reached and vaccinated twice during the immunization response, no matter where they are. Due to the COVID-19 global pandemic, thousands of children have missed out on vaccinations due to the impact on health systems and communities. Furthermore, children who live in remote areas or in conflict-affected communities in Sudan do not always have access to routine vaccination. Every mode of transport possible is used to reach every child. It's critical to work proactively to protect all children in Sudan against vaccine-preventable diseases, which can be achieved through strengthening essential immunization and regular vaccination campaigns to ensure high population immunity. UNICEF manages the global procurement and distribution of over 1 billion doses of polio vaccines annually, accounting for more than 50% of the world's oral polio vaccines. We also provide the needed cold chain equipment to keep vaccines safe and support health worker training on how to keep vaccines safe until it reaches the targeted child. There are two main types of polio vaccines to support the prevention of the disease. One is the inactivated poliovirus vaccine, which is given in either the leg or arm, depending on the age of the child, and the oral polio vaccine, which is the one predominantly used to eradicate polio. Female community mobilizers and health workers at different levels are essential to UNICEF Sudan's continued efforts towards polio eradication. Their support is paramount to building trust and encouraging vaccinations. Increased engagement of women at the front line has proven to be an integral part of the decision-making on whether a patient will be vaccinated. With everyone's commitment, polio can be eradicated. With the support of families, government, decision-makers, and the international community, no child has to suffer.